If you have prostatitis and masturbate, watch this video. Welcome to the Senior Club. Today, we're addressing a topic that might feel a bit personal, but it's vital for men's health, especially for those over 50. We're talking about the link between masturbation and prostate health, particularly inflammation or enlargement of the prostate. The prostate is a small gland, about the size of a walnut, located just below the bladder and in front of the rectum. As men age, this gland often enlarges, a condition known as benign prostatic hyperplasia, BPH. While it's a normal part of aging, it can cause uncomfortable urinary symptoms, such as difficulty starting urination, frequent nighttime trips to the bathroom, or the feeling of incomplete emptying of the bladder. This leads many men to ask, can masturbation affect prostate health? The answer is yes, and mostly in positive ways. Masturbation, or self-stimulation, is a natural, healthy behavior. In later life, it can do more than relieve stress. It can promote relaxation, improve mood, and support emotional well-being. For example, Mr. James, 68, shared how, after losing his wife, he struggled with loneliness and insomnia. Taking time to care for himself, including through masturbation, helped him relax, sleep better, and regain a sense of emotional balance. Beyond these psychological benefits, there are important physical advantages too. Regular sexual activity can improve blood circulation in the genital area, which nourishes tissues with oxygen and may help prevent erectile dysfunction. A common concern among older men, maintaining sexual activity helps preserve sensitivity and function in related organs, supporting both physical and emotional health. Research supports this as well. A U.S. study found that men over 50 who ejaculate regularly, about 2 to 3 times per week, have a lower risk of developing prostate problems compared to those who are less sexually active. Regular ejaculation helps to release built-up pressure in the prostate and can reduce the risk of inflammation due to fluid retention. Mr. John, 72, followed his doctor's recommendation to maintain regular ejaculation through masturbation. After a few months, his nighttime urination and urgency significantly improved. That said, moderation is key. Gentle, mindful self-care that respects your health status is important. If you're dealing with severe prostatitis or ongoing pain, it's best to consult your healthcare provider before continuing. In conclusion, masturbation, when done responsibly, is nothing to feel ashamed about. For many older men, it's a valuable part of maintaining physical and emotional well-being. So take care of yourself, embrace what brings you comfort, and remember, your health and happiness matter. At every age, just keep in mind, while masturbation can support circulation and stress relief, it is not a medical treatment for prostate conditions. Always speak with a healthcare professional about any concerns you may have. Masturbation can be a valuable part of a healthy lifestyle when balanced with other good habits, such as eating a nutritious diet, maintaining a healthy weight, and staying physically active. In particular, exercises that strengthen the pelvic floor, like Kegel exercises, can be especially beneficial for men's sexual and prostate health. Take Mr. Robert, 68, from Texas, for example. After being diagnosed with mild prostate enlargement, he didn't rely solely on medication. Instead, he adopted a more holistic approach, incorporating daily Kegel exercises, adjusting his diet, and occasionally masturbating to stay comfortable and support his reproductive health. Over time, his nighttime urination and related discomfort improved significantly. Have you heard of Kegel exercises and their benefits for sexual performance and reducing erectile dysfunction in men? If you're curious and want us to create a detailed guide on how to do them, drop a 1 in the comments. The more interest we see, the sooner we'll put together a helpful video. Now, back to our main topic. While masturbation can offer benefits, it's not suitable for everyone. Men undergoing treatment for more serious conditions like advanced stage prostate cancer or dealing with acute inflammation may find that masturbation causes pain or discomfort. In such cases, doctors often advise limiting or avoiding sexual activity altogether. The most important thing is to listen to your body, and when in doubt, consult with your healthcare provider to get personalized guidance. On a psychological level, many men worry that masturbation might worsen their condition, and some even carry guilt or shame due to lingering social stigmas. These feelings are completely eddied, but the reality is this: as we grow older, our bodies undergo many natural changes, not just externally, like graying hair or wrinkles, but internally, including in our sexual function. That doesn't mean your desire or your ability to connect with your own body fades away. In fact, when practiced mindfully and comfortably, masturbation can still be a healthy, uplifting part of daily life, helping older men maintain a positive mindset and support prostate wellness. Mr. David, 72, from Tainan, is a great example. After prostate surgery, he felt anxious and unsure whether he could continue masturbating. A candid conversation with his doctor gave him clarity and confidence. With proper advice and reassurance, he now feels at peace and continues to enjoy emotional and physical fulfillment without unnecessary worry. To ensure the experience is both safe and beneficial, it's important to approach masturbation in the right setting. Choose a quiet, private, and comfortable space, like your bedroom, where you can truly relax without interruption. Whether it's during a calm evening or a quiet moment in the day, creating a sense of safety and privacy allows your body to relax, enhancing both your mental and physical comfort. When beginning, there's no need to rush or feel pressured. Take your time. Many people find it helpful to recall comforting memories or visualize peaceful, soothing scenes to help them relax. Using a personal lubricant is also recommended, especially since the skin tends to become more delicate with age. Lubrication helps reduce friction, making the experience gentler and preventing irritation or injury. In terms of how often, health professionals generally suggest that older men engage in masturbation about once or twice a week, though this varies based on individual health and personal comfort. What matters most is that it feels right for you. Don't force yourself if you're not in the mood. Masturbation is a form of self-care, not a chore. If you feel fatigued, experience discomfort, or notice unusual symptoms afterwards, such as lower abdominal pain, a burning sensation, or traces of blood, it's important to pause and consult a healthcare provider for proper evaluation. To sum it up, masturbation can be a healthy and beneficial activity for older men, even those managing prostate issues, as long as it's done safely and with awareness. For many, it supports physical function, emotional connection, and overall well-being. And remember, every person has a unique body and health background. Don't hesitate to speak openly with your doctor or a medical professional. They're there to help you make safe, informed, and empowering choices. If you still have questions or concerns, feel free to leave a comment below this video, and we'll do our best to provide clear and supportive answers. Thanks for tuning in to today's episode. If you found this discussion valuable, please tap the like button. If you haven't subscribed yet, be sure to hit the subscribe button and turn on notifications so you never miss an update about healthy aging and wellness. And if this video helped you, comment 1 below. If you think we could do better, leave a 0. Your feedback helps us improve. See you next time as we continue our journey toward living well, staying healthy, and embracing every stage of life with positivity and purpose.